Hello, my name is Richard Kozub. I am with the Middlesex County Office of Health Services Special Operations Unit. Our office understands that individuals have questions and concerns about the coronavirus. I want to provide you with information that you can use and make informed decisions to protect yourself as well as the community. To understand the risk to yourself and the community, we have to understand what is the novel coronavirus. The novel coronavirus, novel means new, began affecting humans in December of 2019. There is no current vaccine for this. How does the coronavirus spread? It spreads through the air by coughs and sneezes, by touching an object or surface with the virus on it, and then touching your eyes, nose, or mouth. Close contact with those who are sick. We can prevent the spread of the coronavirus by covering coughs and sneezes, washing our hands often or use hand sanitizer when soap, water are not available, staying at home when you are sick, avoiding others who are sick, and cleaning high-touch surfaces. The coronavirus, as most other viruses, are covered under the bloodborne airborne pathogen regulations as a method of compliance. Most of your departments should have a bloodborne pathogen program. We're going to review common bloodborne or airborne pathogens. We're going to discuss risk reduction and describing what to do if you are exposed to a bloodborne pathogen or an airborne pathogen. The term standard precautions or universal precautions has been used as a set of precautions designed to prevent the transmission of bloodborne pathogens or airborne pathogens when providing first aid or health care. We always treat blood and all bodily fluids, coughs and sneezes included, that may contain pathogens from every person as if they carry bloodborne pathogens. Washing hands is the most effective method to prevent infection transmission. To understand how this works, we're going to talk about the chain of infection, which contains three basic elements. One is the organism, which is the germ, the bacteria, the virus, the mold. The pathogen, which is the bad germ. The route, which is the transmission system of how the organism gets from one place to another. And the host, which is the germ condominium, you could call it, where the germ lives and grows. This could be the patient, this could be a bystander, or this could be you. The chain of infection, as you can see by this diagram, is we start with the organism, and in this case, as we've highlighted, the influenza, which is the virus. There has to be a root, which again, as with coronavirus, we're talking about sneezing, coughing, or dirty hands or surfaces. And who's the host? It's the patient, it could be your family, it could be you. The organisms, viruses, bacteria, molds, and funguses, there are thousands of them. Most of them are not problematic. The common troublemakers are bacteria and viruses. Again, the COVID-19 is a virus. Any germ can be problematic in a person with a compromised immune system. The routes of disease transmission are several ways. The three most common are direct contact, indirect contact, and airborne droplets. And we're going to talk about each one individually. So direct contact would be touching blood or bodily fluids. A person touching another person with germs on their hands. Person covers their sneeze or coughed with their hand. You shake their hand. We have direct contact. Indirect contact is, again, someone has this on their hands. They touch an object, and then you touch the object. That is a way of indirect contact. Airborne droplet, probably the biggest one we're going to be worried about and concerned about with COVID-19, is a person inhales the organisms in the air or droplets contaminated with sputum or other secretions from the patient, coughs and sneezes. That's what we're trying to prevent. As a first responder, one of the ways we can stop the transmission is by using personal protective equipment. We want to prevent contact with bodily fluids and other contaminants by using and following PPE. For your hands, wearing gloves. For your face, wearing an N95 respirator and eye protection. Clothing, if you can, a covering gown, or firefighters, your turnout gear. The PPE needs to be appropriate for the method of contact and should be done as soon as possible of contact arising. Better yet, anticipate the potential of contact. If you're responding to a location where we know you have a quarantined individual, put your mask and gloves on first. I want to make the distinction between a respirator for a first responder and a mask. This is a N95 respirator. This is what you as a first responder should be wearing. What the patient wears, or if you come across a person coughing, sneezing, we give them a mask. So the mask goes on the patient, the respirator goes on you as the responder. Just want to make sure we clearly understand the difference. Surgical masks or any of the masks go on the patient, the respirator goes on you. When wearing protective clothing, make sure you follow your local protocols, policies, and procedures. Every department has standard operating guides, standard operating procedures for response with protective equipment. Change your clothing if it becomes soiled by bodily fluids as soon as possible. Handle soiled clothing appropriately and have it laundered. Gloves. Wear your gloves when providing care. Check that the glove is intact. Remove contaminated gloves without touching the contaminated outside surface. Remove them inside out. Dispose of gloves properly. Change gloves and wash your hands between patients. And wear heavy utility gloves if you're cleaning or disinfecting equipment. Eye protection. Do not forget eye protection. Face shields, goggles, glasses. Bloodborne pathogens can enter the body through mucous membranes. Use eye protection for the risk of splashing, coughing, sneezing. Equipment includes shields, glasses, goggles, or prescription glasses. What is a respiratory protection program and what are the elements of that program? Every department has to have a respiratory protection program and policy. That includes selection for the hazard. In this case, we're talking about N95 respirators. Before you wear an N95 respirators, you must complete an OSHA medical evaluation form and have that reviewed. You must be fit tested to make sure the mask fits you correctly. Explanation of its use, how to maintain and care it. You have to have breathing air quality in use. These are not providing oxygen. We have to use them where oxygen is above 19.5%. Don't use these in fire situations. You must be trained and then evaluated. So the N95 mask is a filtering face piece. It's a negative pressure particulate respirator with a filter as an integral part of the face piece, or with the entire face piece composed of the filtering medium, such as the one I demonstrated. The negative pressure means you are the vacuum, you are the pump. One of the reasons we do medical evaluations is we have to assure that you have the lung capacity to pull the air through the filter. There is no pump on this. So the medical evaluation form gets filled out before you get fit tested and before you use the N95. It must be identified by a healthcare professional to review your fit test and your medical evaluation. So the fit testing is before an employee uses the respirator, again, both a negative or positive pressure face piece, the employee must be fit tested. There are a number of different ways that you can use this. We'll be using both qualitative and quantitative fit testing procedures depending on your department. We can break the chain of transmission also by destroying the organism, in this case, the virus, by cleaning and disinfecting, and by using hand hygiene, which is the most important. What is hand hygiene? It's hand washing with soap and water. It's hand cleaning with an antimicrobial soap and water or an alcohol-based waterless solution. Hand hygiene is the single most important means for preventing the spread of infection. Wash your hands. We can also break the chain of transmission by cleaning dirty equipment and surfaces, thoroughly cleaning them with an appropriate germicidal agent and allowed to air dry. The US EPA provides a list of these approved agents for cleaning. When you're using these agents, you need to understand what the chemical is that you're using and use appropriate protective equipment if necessary when using these disinfectants. How can you get information about these chemicals? Well, two primary ways. First is the product label. Read the label before you use the product, as well as something called a product safety data sheet, which is provided by the manufacturer for the product. Almost all of these safety data sheets are also available online via the manufacturer's websites. What is a safety data sheet? A safety data sheet, or what we used to call material safety data sheets, are information sheets on the product that tell what chemicals are in the product, what the hazards of those chemicals are, and how to protect yourself from those hazards. So putting it together, what we've discussed here is the hazard of the COVID-19 virus, the method of transmission, ways to prevent the spread, personal protective equipment, respirators, specifically the N95 respirator, and chemical safety. Before we close out, we want to just review again the signs and symptoms of the COVID-19 virus illness. It is a respiratory illness followed by fever, cough, and shortness of breath. The symptoms can range from mild to severe. What to do if you are sick? Stay home, except to get medical care. Separate yourself from other people and animals in your home. Monitor your symptoms. Call ahead before you visit your doctor. Clean all hard surfaces and employ hand hygiene, and use only EPA-approved disinfectants. For more information, you can contact or look up the New Jersey Department of Health websites, social media, or the CDC website. Here in Middlesex County, you can look up the Middlesex County website as well as Middlesex County social media. I'd like to thank you on behalf of the Middlesex County Department of Public Safety and Health for viewing this presentation. By staying informed and taking simple steps, we can minimize our exposure to COVID-19 to protect our communities. Thank you.